which is acute kidney injury in COVID-19 era. Okay. 2020, this year was actually very weird, with disasters all over the world. COVID-19 being the monster of 2020, WHO considered it as a global pandemic in March 2020. Ahmed Meher Teaching Hospital, one of Ghazi teaching hospitals serving low-income community in Cairo. It's one of few hospitals to have the largest of COVID-19 patients admitted during the pandemic as isolation hospital, with the highest number of dialysis sessions to COVID-19 patients among other hospitals. As Dr. Mohammed Fawzi Souda, the head of Ghazi, mentioned in his report, we were on the top of the list on dialyzing patients with COVID-19 on that wave. This is our research work team with Dr. Adel Afifi was inspired one for our team. It is a multi-center. Our aim was to assess the occurrence of acute kidney injury in Egyptian COVID-19 patients, as well as the clinical features and outcomes associated with acute kidney injury in COVID-19 patients. Especially at that time, there were no or little information on AKI in COVID-19 has been published in Egypt. Ethical approval we took the ethical approval of Ghazi on July 2020, and we started to collect data from all hospitalized patients in the hospital regarding the demographic data, the presentation of COVID-19, occurrence of AKI, the laboratory result, and the outcomes. All individuals greater than 18-year-old admitted to Ahmed Meher Teaching Hospital with COVID-19 between 6th of June to 25th of July were included in the study. COVID-19 patients on maintenance hemodialysis and renal transplantation recipient were excluded. Cases with COVID-19 infection has been diagnosed dependent on clinical manifestation, radiological lung characteristic, and positive PCR of nasal and pharyngeal swab at the time. Patients were classified to three main groups. Home isolation group with mild symptoms did not need for supplementary oxygen. Hospitalized group, moderate symptoms requirement for oxygen supplementation and respiratory distress with oxygen saturation below 93% at room air, and the ICU admission group with severe symptoms with respiratory failure, mechanical ventilation, shock, multiple organ failure. This is a flow chart of the study. COVID-19 patient number can 734 patient. We exclude 83 patients as we mentioned. Patients were followed up for development of acute kidney injury and the need for dialysis or not, hospitalization or home isolation. The overall incidence of acute kidney injury was 14%. AKI developed in hospitalized COVID-19 patients with 14.7%, and in home isolated COVID-19 patients with 10.8%. This is COVID-19 patient with and without acute kidney injury. Patient who developed acute kidney injury had no any significant relationship with comorbid condition, including diabetes mellitus, heart disease, cancer, and hypertension, but had higher level of inflammatory markers زي D-dimer and C-reactive protein and kidney function test, of course, than the non-acute kidney injury group. This is acute kidney injury patient with and without the need for dialysis. COVID-19 patient with acute kidney injury who needed hemodialysis was 37%, had significant higher percentage with comorbid condition, including diabetes, cardiac disease, cancer, and hypertension, had also significant higher levels of inflammatory markers, as we mentioned, C-reactive protein and the D-dimer and kidney function test, than AKI patient who did not require hemodialysis. 76% of severe ICU COVID-19 patients who developed acute kidney injury required hemodialysis. 24.5% of hospitalized COVID-19 patients who developed AKI required also hemodialysis. Patients who developed AKI and were isolated at home did not require hemodialysis. Regarding the mortality rate, overall mortality rate was 6.3%, 15.4% in COVID-19 patient with AKI, and 4.8% in COVID-19 patient without AKI. 38.3% in AKI patient who required hemodialysis, and 1.7% in AKI patient who did not require hemodialysis. COVID-19 patient with acute kidney injury who needed dialysis were significantly higher in hospital death. Our conclusion, according to the finding of this study, AKI occur in 14% of COVID-19 patients. Our findings suggest that COVID-19 cases, particularly those in the ICU, should be closely monitored for the progression of AKI. Early detection of AKI and prompt medication may improve COVID-19 patient outcomes. Our study or article accepted in the Renal Replacement Therapy Journal. It received in January and published in June 2021. And thank you very much.